Voilà, bonjour, aujourd'hui bon matin, Topik Konversasyon. Par l'habitude, dans nos deuxième temps, il y a nous rencontrer différentes personnalités, connaître un petit peu les autres travail, et plus important, qui bon service qu'ils ont paré pour offrir nous. Aujourd'hui, bon matin, pas nous follow mon sous Cécile, ça monsieur des années auparavant, et ça c'est pas l'autre qui Dr. Eric Liche. Dr. Eric, good morning, how are you?
Good morning.
It's a pleasure to have you. You're back again on Bozo Cecil.
Yes.
We had the same conversation, I think it was like 2 years ago, wasn't it?
Approximately, yes.
Approximately 2 years ago. How has it been, your journey so far with Seychelles? Because I think you're in love with Seychelles right now.
I am.
Yes.
And it is a long love story.
It's a long love story.
Yes, it began back 2006.
Oh, wow.
When I joined as a dedicated general surgeon at the Victoria, by that time, Victoria Hospital.
Had you heard of Seychelles before you came to work for Victoria
Seychelles.
Hospital? Yes, the Seychelles Hospital.
I know about Seychelles because I met in Cuba Dr. Reginald when he was getting his training there as a doctor,
Yes.
as a surgeon.
Yeah.
So I got to know Seychelles since that time.
So ever since you wanted to come here,
Definitely.
but there is a lot of similarities between Seychelles and Cuba, isn't it?
Yes.
Tropical island.
That's it. We're Iceland, so
Yeah.
it's very similar.
Similar.
We are very similar. People are
Yes.
similar. The weather, climate, the beaches.
The
as well.
dancing.
Well, there's a lot of rhythm.
Same rhythm, huh? But doctor, of course, your beautiful country, it's so rich in its history, and you've decided to come all across the world and visit a tiny little dot in the Indian Ocean. Your first coming into Seychelles, your first impression of Seychelles, how was it for you?
It was amazing.
Yeah.
As I told you, my first time wasn't really to work, but
Okay.
I came invited by Dr. Reginald because it was her birthday.
Okay.
So I spent a month here.
Yes.
And it was when I got to know local people, Seychellois, and I fall in love with them.
And of course, now you have your clinic and you are rendering services to some amazing women in Seychelles. We know that a lot of people have contradictory views about beauty, about cosmetics, about surgery, or about enhancing one's personal, vision and appearance. What are your thoughts on that? Especially because I know your services it's not just for the ladies, it's also for everyone in general, for men as well. What are your thoughts about people who, might have some mixed feelings about cosmetic surgery or any services under your portfolio?
No, it is normal.
Yes.
When you don't know about something, you can have some reluctance.
Okay.
But once you get to know the services that can be offered nowadays,
Yeah.
definitely you will accept it.
Okay.
And once, as I usually say to my patients, once you are on this, there is no way back.
Yeah.
Because when you get introduced to these services, you will not masquerade the aging symptoms. We improve it from within. So we work at the cellular level, and the patient feel better. When you patient see at the mirror, they feel more confident.
Yeah.
And this confidence, and this is about health as well.
Exactly. It's your mental health as well.
Definitely, it is.
Embracing your beauty, and whether it's enhanced or not, whether you choose to do it via surgery, that's just like wearing makeup, isn't it? Yeah.
Correct.
Exactly. All right. So in terms of training, doctor, your trainings were in Cuba itself, or was it another country across the world?
Well, my initial training was in Cuba.
Okay.
I graduated there as a doctor and as a general surgeon.
Yeah.
Later on, I continued my training in Europe.
Okay.
Basically in Spain. I did a master in minimal invasive surgery.
Okay.
I did a master as well in aesthetic medicine.
Okay.
I have a training as well on anti-aging medicine in Miami.
Yeah.
So it is wide. I have a lot of training as a background.
Why in that field? I mean, in medicine, there's so many fields, and you being a general surgeon, obviously, you could have chosen anything to specialize in, but you decided to embrace that field. Why such a decision?
After being a surgeon for 20 years, I realized that there should be another way to help people.
Okay.
Not only doing big surgeries, though we do it, but there are other ways of helping people to achieve what they want, to make them feel younger and happier.
Okay.
So that's why we did just shift to the right, let's say, to the cosmetic medicine and cosmetic surgery.
And what are some of of course, when we talk about cosmetic surgery, we talk about cosmetic medicine, as you call it. What are some of the things that you are offering the Seychellois that possibly are thinking of coming to your clinic for services?
Oh, nowadays, I can tell you there is no need for a Seychellois, for a local, to board a plane, to go to Europe or Dubai
Yes.
for a specialized cosmetic procedure, name it medical or surgical.
Yes.
Because nowadays we are ready to offer here. And I can tell you with the highest European standards.
Okay.
We can offer from blepharoplasty, that let me tell you as well, blepharoplasty is not only a cosmetic procedure. Sometimes it is needed medically.
Okay.
We do as well tummy tuck, breast reduction,
Yes.
breast lift, liposuction, you name it. All procedures we can be done here safely, because I don't do it in my clinic,
Yes.
but we can do it in 2 clinics that they have state-of-the-art equipment, so
Okay.
it can be done safely.
So you're partnering with other clinics in Seychelles
Yes,
for, in order
definitely.
for you to facilitate your services.
Definitely.
And of course, you've had, over the years that you've been here, you've had many clients. Are they satisfied with the quality of services that you're offering them?
I can tell you that I have clients that they have been coming back to me for the last 10, 15 years
Yeah.
to get the cosmetic procedures done, and some of them as well surgeries. But I am as well surprised that I am receiving patients for general surgery, though this is not our main
Yes.
service. We are getting as well patients because they know my story. They know I've been here
Yeah.
for a long time, that I worked here as a general surgeon.
Yeah.
So,
So they're also coming for that as well?
yes, they are coming for a general surgery procedure as well.
Alright, ok, mesdames et messieurs, sorti bon matin, nous pekos avec Dr. Eric. Et si ma ou beze kon li, si tan beaucoup l'année qui vient Cécile, et là, pareil, dit, il y en a un autre département qui li, il spécialise là-dedans, et ça, c'est cosmetic surgery, côté où, si on envie, ou capable arrange au visage, ou capable arrange ou grosseur qui on a, il réduit, bonne madame qui peut-être d'autres tétés un peu trop gros, il donne d'autres problèmes les dos, tout ça là, bonne quelque chose qui affecte les autres, et les autres, il est capable de réduire grosseur au tété, ou sinon, si ou un des monde qui peut-être est petit et ou envie de faire les veines plus gros, ou envie de faire formation les corps un peu plus joli, ou envie de retirer un peu la graisse, pas nécessairement ou content, là au début devant la glace, ou peut regarder, et si ou un des monde qui ont l'argent, qui est capable d'afford, pourquoi pas, s'il y a quelque chose qui ont envie de faire pour traiter tous les corps, ou décision personnelle. What are some of the, before going and making a decision, because this is a big decision, despite the fact that we say cosmetic surgery, it is a very serious issue we need to talk about. What are some of the lining up before we decide? For example, if I'm to come and, I don't know, enhance my breast, okay, what are some of the go-through that I have to prepare myself? Preparation for such a decision. I believe it starts even before we go into the operation.
No, definitely.
Oh, yeah.
There is a protocol,
Yes.
okay, that we have to follow.
Yes.
Once the patient take the decision to visit me, the surgical
Yes.
decision is not taken yet. I have to examine him and the patient, and as well to know expectation. This is important.
Okay.
If I can fulfill expectation, then we start this long journey.
Okay.
We have to make sure that the patient is healthy enough to undergo a general anesthesia.
Okay.
So patient will be seen by an anesthesiologist.
Yeah.
It's going to go under a pre-op assessment.
Okay.
If everything is okay, then we can move forward with the procedure.
So that's a whole consultation right there prior to even
Definitely.
making a decision on what
Definitely.
the person wants to do.
If a procedure is not safe enough because the patient has any medical condition,
Yeah.
it is not going to be done.
What are some of the medical conditions, doctor, that may compromise a decision for somebody, a client to have a surgery, a patient to have a surgery?
Patient with bleeding problems,
Okay.
or patient with chronic condition that they are not stable, they
Okay.
are not controlled. These are the only
These
contraindications.
are fundamental.
Yes. Age, for example, is not a problem.
Age is not a problem.
No.
Okay. So, age is not a problem, mesdames et messieurs. Is it, as cliche as it might sound, age is just a number that they say? So, doctor confirmed it today. Well, hello there. Mon name is Monsieur Kinvinik, a gentleman joining our conversation. Good morning. Bonjour, San. Is that, what about men who want to reduce belly fat? Okay, and will it leave visible scars? Doctor, San is considering a tummy tuck? Would that be, yeah? Reduced belly fat or liposuction, I suppose?
Not necessary.
Okay.
It depends on the skin condition. If the skin is healthy, let's say it's not hanging,
Okay.
we can do a liposuction and no scar will be visible. So we can do procedures, scarless procedure. It depends on the skin quality.
Okay, so there, can I, correct me if I'm wrong, there are non-invasive and invasive procedures.
Definitely. We have minimal invasive procedure.
Yeah.
That even we can do under local sedation.
Okay.
That we don't have to put the patient to sleep
Okay.
with general anesthesia. So they are even safer.
I suppose that's where the laser treatment comes in as well, because
This
I heard
is-
you've got some state-of-the-art equipments right there.
This is one of our aim.
Okay.
In order to be able to offer European standards, we have included in our armamentarium some of the most advanced laser platforms.
Okay.
And one of these is a diode laser to perform liposuction safely.
Okay.
Laser will help us to melt the fat, and so through thin incision and thin cannula, 2-3 millimeters, we'll be able to remove the fat without making large incisions.
But that's a drastic difference before and after, even
Definitely.
by 3
improve a lot-
millimeters, isn't it?
improve a lot body contour.
OK. All right. Mesdames et messieurs, aujourd'hui, bon matin. Question. Pas 10 messieurs, pas 10 madame. En effet, tous les deux sont capables d'explorer sa bonne possibilité. Si on dit monde qui senti ou envie faire une différence, ou on a ou l'argent et ou envie venir pour considérer sa bonne option. Et pareil, docteur dit, il passe 10 parfois pour la beauté, mais aussi pour raison médicale, pour aider ou réadapter, refaire et même améliorer aux conditions médicales pour un petit peu plus en bonne santé. Now, I do have somebody coming into our conversation. Good morning, bonjour. She is wondering well, she's going along the same line as Sylvie. For breast enhancing, how long does it take, the recovery time, doctor? Recovery time for breast enhancing?
Yes, it depends on the initial condition.
Okay.
If we have just to do a breast augmentation with implants, for example, I can tell you the patient can go back to social life, let's say, in 7 to 10 days.
7 to 10 days.
If we have to do a breast reduction in a massive giant breast,
Yeah.
it can take a bit longer.
Okay. So the
Then-
reduction it takes a little longer than if it was
Yes.
to be enhanced.
Let's say that.
All right, and a tummy tuck maybe? How long?
Tummy tuck, 10 days approximately.
10 days approximately. What happens in tummy tuck? Because I've always been interested to know. For example, a lot of us ladies in Seychelles, we suffer from the scars on our tummy. Okay, after childbirth, and a lot of people say, yes, it is something that is beautiful. It's, you know, it reminds you of your children. But it's also something that a lot of ladies are very conscious about. Can tummy tuck be used for that, to remove the scarred skin? How does that go?
Well, I can tell you that tummy tuck is a life-changing procedure.
Okay.
You see, because we can remove, because we usually combine it with laser liposuction.
Okay.
So we can remove a lot of fat, we can
Yeah.
remove the excess of skin
Yeah.
as a result of the pregnancy, okay, with the striae as well. All this can be removed, and we reposition the umbilicus.
I was about to ask you about the umbilicus, because that's fundamental. That the whole day is like,
No, we reposition the umbilicus, and
Yes.
the scar is going to be hidden under the underwear, under
The
panty,
bikini line.
the bikini line.
okay, all right. Bonjour, mesdames et messieurs. Mon contact. I like how everybody is very interested this morning to ask questions. Facelift, doctor, is that an option in Seychelles as well?
Definitely, I have performed several facelift in Seychelles, and
Okay.
I have happy patients. And the point is that you don't realize because the
It's so
scars
good.
are hidden.
He's
No, because the scars are hidden.
yes.
You cannot see it because they are
Because-
hidden behind the ears.
That's fundamental, isn't it? Hiding it, but making it look so natural. Because you have some people who are just stretched out. From overseas, you've seen that. But I see cosmetic surgery in itself is evolving, isn't it?
It is. It is
How do you
funny.
keep up?
It is funny because previously, as you said, a facelift, it would look like an old person
Yeah.
with the fan blowing in front of the face.
Yes.
But nowadays, it has changed. We have tried to achieve more natural results.
Yeah.
So surgical steps are changing as well.
Injection and filling in the, for example, under the eye, if I'm having that a little bit, you know, the sunken eye. Injection of I can't remember what it is.
Hyaluronic acid.
Yes.
No, this is one of this was hyaluronic acid, the filler. It's one of the first product that we start using a long time back.
Yes.
But nowadays we work more, as I mentioned before, at a cellular level.
Okay.
We use, for example, a product that name is polynucleotides.
Okay.
These are like messengers that they carry information, and depending on what our main is, they will work. For example, if we want to make a hair growth, it is used for that aspect. If we want to improve under eye darkness, we have a specific polynucleotide for that. Or we want as well enhance collagen production to improve skin elasticity. There is a lot of new products in the market now.
Okay, Doctor, good morning. Vanessa comes into to the conversation, and she wants to know, what are your thoughts on Botox?
Well, I can tell you, Botox was not designed initially as a cosmetic procedure.
Okay.
There's a long story in Botox. It is a medication that has been used in a long time.
Yeah.
As a in the conventional medicine. So it has a long track and it's very safe.
Okay.
It can be done.
And we're still using Botox nowadays, or has it been
I can
put
tell
aside?
You,
and
no, not at all.
Oh.
Botox is the most used cosmetic treatment or performed cosmetic treatment nowadays.
Yes.
Wherever you go, this is the number one.
What does it do exactly? The Botox. What does it do?
It is important. Botox is not a filler.
Okay.
Botox will relax muscle.
Okay.
So will make would relax wrinkles and make it smooth.
Okay.
That's what it does. The main idea of the Botox is not to paralyze, to frozen the face. Is to relax muscle, so in a way you can show emotions, but with less wrinkles.
Less wrinkles, more emotions, mesdames et messieurs. The option to turn to Botox, as Doctor has said. It is one of the safest procedures you can adopt if you don't want to go the full facelift, etc. Am I right?
There's a lot of combination now, treatment that we can do if patient doesn't want to embark on a surgical procedure.
Okay, now, Doctor, let's talk about, let's stay with that conversation in terms of the facial, because a lot of people, birthmarks, I have somebody asked you, can we remove birthmarks? Has cosmetic surgery evolved that, you know, those big birthmarks that we have on facial birthmarks, can those be removed?
Sometimes we can.
Okay.
It is needed an assessment. We cannot promise that. But with those laser platform that we have, we can treat those birthmarks nowadays.
Yeah, there is a possibility.
There's a possibility.
But a consultation needs to be done.
Perfect.
All right. Frankie, bonjour. Frankie wants to know, hair implants, doctor? Not yet.
Well, I can tell you. No, because...
these guys are on fire today, huh?
It is needed a lot of condition aside. We, not only me, I know, I have an expert on hair implantation. And I do that back in Spain and Barcelona.
Okay.
But the point is that you need as well 2 technicians.
Okay.
And here in Seychelles, unfortunately, we don't have a technician training on that field. So it's very difficult to offer it.
But if you have a demand in Seychelles, would you consider coming down with 2 technicians to be able to do that? Or the environment is not conducive for this?
No, it's not the environment. It's staff.
Staff. So maybe it's time to consider staff coming down. Yeah, well, doctor, there you go. Something. I've got somebody coming in and said, bonjour Sylvie, côté docteur y basé pe travail. Where are you based, doctor?
Well, we are based in Spain, mainly in Barcelona and Zaragoza. We have 2 clinics there, and that's where we mostly work. But I can tell you as well that on our last conversation, I was coming to Seychelles every 2-3 months.
Yeah.
But I can tell you happily now, I am coming here every single month.
So every single month, doctor is coming into the country. And of course, they have to book. Which clinic are you associated with for bookings for the clients to?
For this, well, they have to book through our platform. So Victoria Aesthetics.
Okay.
But when we do surgery, we will perform the surgery en Setual, Victoria Clinic, or at, here in center of town, Murtis Clinic.
Okay.
Because these are the 2 approved medical facility for surgical procedures.
All right. right. So, voilà, mesdames et messieurs, ou capable. À moment pas considérer ou booker un appointement ou voir docteur ou gagne sens pour dialoguer, regarder un petit peu ou la base médicale, comment il a été ou la santé en général et après là, je vais commencer la conversation pour autres guetter qui bonne procédure qui ou envie faire le niveau. OK, moi somebody's like, any idea of the cost? Well, of course, if you want to know the cost, you have to have a conversation with doctor. Set an appointment, and that will be the way to go prior to the cost. At the end of the day, it's up to you to decide how far your pocket, how deep your pocket will be in terms of what procedure you want to do. I've got somebody coming in concerning reduction of weight, but by bypass. Is that correct, doctor? Do you do that as well?
No, we don't perform that. It's a bariatric surgery.
Yes.
No, but nowadays, I can tell you, I am a surgeon. I have a training on endoscopy surgery, so I used to do bariatric procedure, but I can tell you that I will not do it anymore. Why? Because nowadays, we have different choices, but they are really less invasive.
Yeah.
Like this weight loss medication that we have now.
Okay.
That we are able, with the minimal side effects, a minimal complication to reduce up to 25% of body weight in 3 to 6 months.
Okay.
Without exposing the patient to a surgical procedure and to the complication of surgical procedures.
And that's definitely non-invasive.
Not at all. It is a weekly injection.
A weekly injection.
Yes, it is medication approved by the FDA, European, and all medical authorities.
So that's an option to explore prior to deciding whether you want to do surgery or not.
I think there is no room for surgery now.
Okay.
Because with this medication, with one weekly injection, and as well, it is educational. Because the idea is not to keep the patient on medication for life.
Yeah.
So we have to change habits on the patient.
Yeah.
Weekly injection, 6 months, depends on the initial weight. We can reduce 25% of total body weight.
Okay,
so
doctor,
no
look
need
at
surgery.
me right now, how big I am. How I would be shedding that like with
6 months.
6 months. I should be like, I think I'm ranging between 90, 92, if I'm not
It
mistaken.
depends on your height. What's your height?
I think I'm 162.
162. Well, for you, a healthy
I'm not
weight
good
should
right now,
be
my weight.
a healthy weight should be around 75.
Yeah.
You don't need to be like a Brook law
No, I don't-
that they use in Europe
Yeah.
because we look sick.
I don't want to look like a piece of like a toothpick.
We are
No.
not European.
I'm a mother of 5. I like my curvy-licious. A little bit of curves. Can we like decide where we want to trim it?
Definitely we can, and as well, it is important. We have as well fat dissolving injection.
Okay.
When there is no obesity, just fat accumulation in some areas, we can, with a teeny needle, we can inject this medication that
Okay.
will dissolve the fat, will destroy fat for good. This fat will not come back.
Oh.
But if there is
Yeah.
obesity, then we will need the previous medication.
Marisa came in and said on a scale of 1 to 10, doctor, that what you're talking about right now, Sylvie, how painful is it? she's
Not-
thinking about it right
It's
now.
not painful at all.
Not painful at all. Are we talking about a needle the same as Botox?
Even smaller.
Yeah, oh, well, there you go, Marisa. Done deal. Done deal. All right, mesdames et messieurs, aujourd'hui bon matin, we have a conversation avec Dr. Eric qui vient causer pour Victoria Aesthetics ou capable de cet appointement et of course on a aucun processus procédé qu'on a envie de faire ou capable de regarder, explorer, voir de l'information. Pourquoi il est vraiment important, l'information il y en a et où besoin de faire au bout approcher consultation et gagner l'information et après là on va décider qui on envie de faire. Nous pouvons une petite pause commerciale et là nous retourner on va continuer avec une conversation avec Dr. Eric. Et voilà, aujourd'hui, pour matin, nous continuons la conversation avec Dr. Eric, Victoria Aesthetics. Ça le doit pour où qui peut décider pour faire un changement, pour où qui est capable de dans l'investissement, pour investir dans les corps. Beaucoup de nous causent le self-investment. Self-investment for our own beauty, for what we think and what we want. For ourselves. And this morning, our conversation is with Dr. Eric. We're talking about prices. Somebody asked about prices, and I did say have a consultation, but you're ready to talk about prices.
Definitely.
Obviously, we have to be realistic, doctors. There are certain procedures. These are state-of-the-art machines you're using, state-of-the-art procedures you are practicing. Price range. What are some of the price range we're talking about, like some of the common services that people are really into?
No, it depends. For example, Botox. This is
Yes.
the most common, and I can tell you safest procedure. It depends on the area we treat, but we can work from 2,000 rupees, 6,000 rupees. It depends on the area that you want to improve.
That's a full package.
That's
Okay.
it.
And what
As
about
well, it depends all as well on your patient expectation.
Yes.
Okay, patient age. It's not the same to undergo a aesthetic procedure if you are 30, 35, if you are 65.
Okay.
When the older we are, the more an advanced procedure we need.
Yeah.
But what is important is that it is an investment in your mental health.
Yeah.
That's what we have to take into consideration. And if the patient has decided to perform this procedure, what is important is the cost that will come if patient has to travel abroad.
Yeah.
If he has to board a plane.
Okay.
And as well,
Accommodation.
have to pay for accommodation. And
Yeah.
if something goes wrong, because this can happen,
Yes.
patient has to take plane back to be seen by the doctor.
Yeah.
And the contrary, I am here.
Okay.
And we have as well, we have another doctor that is on the training as well. So patient is going to be covered during the follow-up process. So
Yeah.
patient doesn't have to travel again.
Yeah.
And the cost is going to be cheaper in Seychelles. And I can tell you at the European standards, that's the most important.
European standards procedures ranging from 2,000 to 6,000 rupees. I do have people asking about the breast implants. Is it implants or is it, what are we calling it now, doctor?
Yes, breast implants.
Breast implants. What are we using right now? Because a long time ago we used to use silicons. Are we still using this? Or has it changed over the years?
Well, it has not changed. We still use silicone, but there
Yes.
are other devices as well.
Okay.
That does it with the saline, with the, let's say with the water.
Okay.
But the surface is silicone. Eh?
Silicone. What about removing our own fat and putting it, implanting it into our breast? Does that?
It is feasible.
Okay.
But it depends. First, patient has to have enough fat to be removed from one area of the
I
body.
think I have enough fat, doctor. Take it from here and put it here. I should be good to go. With a little lift.
And as well, yes, definitely. But it has it depends as well on the initial condition of
Yeah.
the breast. If the breasts are sagging, if we add weight on the breast, it's going to sag a bit more.
So it has to be viewed, and that's the mathematics between the doctors.
That's it.
Yeah. All right, mesdames et messieurs, aujourd'hui, bon matin, nous pouvons faire conversation. Victoria Aesthetics and, of course, ou capable demander bonne question. We have somebody coming in and said, suction belly fat remove can do locally, and the price, please. 474. Liposuction?
Yes.
Ranging?
Liposuction, it depends as well.
Okay.
We quote the liposuction depending on the area that patient want to have a liposuction done. One area, for example, it is around 15,000 rupees.
Okay.
If we have to do a massive liposuction, of course, it depends on the
Yeah.
work that has to be done. Because we have to take into consideration as well that we have to cover the operation theater cost.
Yeah.
Anesthesiologists, the assistant, surgical assistant, the circulating nurses.
It's just like when you go overseas, they charge you for every piece of instrument that is used, for every material that is used, for the hour.
That's it.
It's exactly the same.
It's the same.
The calculation is the same.
It's the same.
Oh.
Here, that when you do in Seychelles, you remove ticket, cost, accommodation.
Yep. And pocket money, etc. And of course, you're close to home, the comfort of your home, but also family and friends.
And the follow-up, of course.
Yes, the
And
follow-up as well, which is very important in the post-care after. We've got somebody here saying tummy tuck. They're really going forward with this. Tummy tuck, doctor. Price ranging for tummy tuck? Are we
It is from 55.
55? So that is something to explore if you want to. Of course, as we said, these are state-of-the-art operations and procedures, and using the state-of-the-art machines. And of course, whether you want to pursue that kind of decision, that it is very important for you to have a consultative meeting with your doctor. Dr. Eric will be here. How long are you here for, doctor?
Well, I came on the 15th, and I will be going back to Spain on the 1st.
But I'm pretty sure you're very busy already.
Yes, we are.
But you have time for the other people as well.
We do have.
Oh, but there you go. All right. Aujourd'hui, mon matin, ou capable de décider pour une décision, puis tout ou après-demain, et voilà. On va gagner ça pour capable d'explorer une possibilité. Quoi qu'ils ont envie de faire et quoi qu'ils ont envie demander l'information, question là, etc. Also, how young can one start to consider? I mean, let's take a basic treatment, Botox. How young can somebody how young is too young, if I can put it that way?
Oh, we can say now that we can divide the cosmetic procedures
Yes.
according to the patient age.
Okay.
Nowadays, we can do, for example, skin booster that will not change the feature.
Yeah.
Patient doesn't need invasive or really advanced procedure. So only to improve the skin or to prevent skin aging.
Okay.
Now that it is possible.
Aren't we define nature there, doctor?
And we have patients 25, 30 already
Yes.
undergoing this because they want to prevent or slow down aging.
Okay. Everybody wants to look good, right? There's no harm in that.
No, as well. And it is not only medical.
Yes.
Not only cosmetic. Some patients, I have done perform surgery in Seychelles with very young patient with a giant breast.
Yeah.
That they don't have a proper life.
Yeah.
You see, because they cannot go. It's amazing. I have a patient that she came. She has been to the beach after the surgery because she was ashamed of showing her body.
Yeah.
So-
But now it's fine.
Yes,
She's comfortable
And-
now.
definitely she is.
I'm assuming she's very happy.
So do I.
It is both ways, isn't it? For
Definitely.
you to give somebody literally you're giving them their life back, isn't it? In that sense, so that they can actually do the things that they love and be with the people they love and have a different life. And there's a price to pay for that, obviously. And if you are ready to invest in that, it's a decision. It's a personal decision. And don't let people change your mind. You feel what you feel is good for you. You do it. As simple as that. Doctor, we're going to post-care in Seychelles. Of course, there's there's the surgery or procedure, and then the post-care. Everything in Seychelles for any services that you do doesn't require us to move overseas
Not
for
at
further
all.
treatment.
We are ready to do a proper follow-up.
Yes.
So we have the equipment we need if a complication appears, because this can happen.
Yeah.
And we are ready for that, to cover all what it is needed. And it is important. In the cost, it is included the follow-up. Whatever it is needed,
Yes.
unless it is a surgical procedure,
Yes.
we will cover up for the patient.
And of course, are patients required to take on insurances, doctor? Life insurance or medical insurances for those procedures in Seychelles?
We are,
Similarly
working,
as if they would be traveling overseas?
we are working on that.
Yeah.
And as well, I can tell you as well, we're talking about the cost, that we are a partnership with some banking institution
Okay.
to be able to offer medical credit or loans for patients,
Oh.
even on our field.
Okay. Now, one honest question, doctor. Are you that kind of doctor that tells your patient, okay, enough is enough now. Stop. It's too much.
I do.
You do.
Of course, because
Because
when-
some people can get carried away.
No, but my patient can tell you. You see, because I tell them, I won't do that because your face is what they people will see,
Yes.
and they will tell that it was done by Dr. Licea.
That's your brand.
Definitely,
Yeah.
definitely.
So you will draw
Well,
the line.
I can tell you. You see, I tell the patient, I don't want that money.
Okay.
I mention expectation because this is very important.
Yeah.
If you need more than a Botox,
Yeah.
and you are expecting that you will rejuvenate, I will tell you, I will not do Botox on you only.
Okay.
If this is what you can afford and you are expecting this, I don't want that money because you are not going to be happy.
Okay.
And on the other way as well, there's a patient that they can afford and they keep on doing cosmetic procedures,
Yeah.
and they are overdue. As
Okay.
well, I tell, I am not the doctor. I don't want that money.
Okay.
That's it.
And you draw the line.
Because it's my as you said, this is my brand.
Exactly. It's your brand as well, and it's very important for you. Now, ladies and gentlemen, this morning we're having a conversation with Dr. Eric, and of course, we're wrapping up our conversation. I know you guys have a lot of questions, but I would strongly recommend to book your consultative appointment with Dr. Eric and have that conversation and decide on what procedures you want to be. I know a lot of you are talking about liposections. A lot of you are talking about tummy tuck. A lot of you are talking about breast implants as well. So these are procedures which maybe you might find is necessary for you, but at the end of the day, you need to have that conversation with doctor and decide on the procedures that you want to do. Doctors, any last words you want to share with the ladies and gents? Because I can't just say ladies right now, because it's moved beyond that.
Not anymore.
Not anymore.
I can tell you, yes.
Men are very conscious about themselves, aren't they?
5 years back, it
Yes.
was mainly a girl's domain. Now,
Yeah.
I can tell you, approximately 20% of our patients are male. And there is a lot of conditions that they are coming to improve, not only
What
face.
changed for men? What changed that they suddenly decided, oh, we want to take care of us? Because before it was just like, I won't care, I've got a big belly, I'm good, I'm done. But now men are becoming more
Conscious. That's it, because
Yeah.
we are now more conscious about, and this is not only cosmetic, this is health as well, mental
Yeah.
health, and this is important.
Okay.
That's what they are coming more and more.
All right.
And as well, because the procedures are minimally invasive,
Yes.
so they can somehow continue with their social life.
Less pain, quick recovery, and I suppose time is money, isn't it? At the
Definitely.
end of the day.
And natural results. That's it, what they want.
Yes, make up your mind and decide what you want, and of course, prioritize, definitively, and have a conversation with Dr. Eric. He'll walk you through, and you guys can have that journey together and decide what you want to do. And of course, at the end of the day, you know what they say, cliche as it might sound, beauty is only skin deep, but it does have the psychological aspect of it. Your well-being, your mental well-being, of being happy and free and liberated to live your life as beautiful as can be. With a little bit of help from Dr. Eric.
As I mentioned as well, this is not anymore masquerading
Yes.
the aging effect.
Yeah.
We rejuvenate the patient. We work at cellular level from within. It's not only to cover the wrinkles.
Yes.
Patient feel better. Both, because we do as well, for example, hormone replacement therapy
Yeah.
together with this, because this is combined.
Yeah.
So patient will feel younger, stronger. Both will perform better sexually, for example.
Okay.
That's
Yeah,
a lot
it's
of,
good. It does increase it, doesn't it? I mean, when you feel good and you look good, it does have a.
Definitely.
I mean, you know, gets it working. All right. On this note, Doctor, it was an absolute pleasure having you this morning on the show. Thank you for coming and giving everyone the information that they need, and of course, hopefully, you'll
Thank
receive
you
them
for
very soon.
inviting me.
Once
Again.
again, we had that conversation, and you're going to come back one day again, and we're going to have the conversation and see how it is. But all the best, and thank you for coming this morning. It
Thank
was
you
an
for
absolute
inviting.
pleasure. Thank you, mesdames et messieurs. Dr. Eric, Victoria Aesthetics, Isalandoa, kote si Wendy Moon qui pas senti ou bien dans la peau, si Wendy Moon qui peut considérer certains procédés, qui ont envie d'explorer, certains, si on ça dit monde qui peut-être simplement ont envie de commencer avec sa premier pas, gagner les formations et au procès sur les formations, regarder quoi qu'ils ont envie, qui est-ce qui est adapté pour ou comment ça individuel. Of course, Dr. Eric va donner tout le monde les formations que vous avez besoin nécessaires et ou at the end of the day, on va prendre une décision qui ou senti idéal avec consultation. Dr. Eric, côte Victoria Aesthetics. Notre petit call et regardez qui est une option, un service qu'ils ont pour faire ou. And of course, par dit, state of the art, European standard, avec faire business travel, qu'on est capable de faire tout ça là, ici même, dans la terre Cécile de la Cour. Alors ça, c'était une Topik conversation pour aujourd'hui bon matin.